again, I'm Lennox Hoyt, MD, fellowship-trained, board-certified urogynecologist and pelvic surgeon. Today we're talking about diagnosis of fistulas. We reviewed earlier that fistulas are abnormal connections between organs. Examples of fistulas are vesicovaginal fistulas, fistula between the bladder and the vagina, and rectovaginal fistulas, fistulas between the rectum and the vagina. So how do you diagnose this? Fistulas. First thing is the patient's complaint. So the patient will come or notice that there's urine leakage constantly happening, and they may or may not notice that the urine is leaking through the vagina all the time. Another complaint might be, it's rare, but stool coming out of the vagina. If you have such a complaint, it's going to be really important for you to find the right kind of doctor to evaluate it. And usually it begins with an exam of the vagina, a speculum exam, for example. If you look with the speculum and you see pooling of urine in the back of the vagina in the speculum exam, that usually is a good hint that there might be a fistula going on there. And then the question at that point is to diagnose or determine where the fistula is. That's where we come to the process called fistula mapping. Usually probably would start with a test called a cystoscopy, which is a way of looking inside the bladder with a camera that can usually be done in the office. If the fistula is obvious at that time, it can be identified. The test that needs to be conducted would be to fill the bladder with liquid, normal saline usually, and watch the vagina to see if there's leakage into the vagina. So leakage of liquid filling the bladder coming out of the vagina, if you will. If you fill the bladder and the leakage is coming from the vagina, that's pretty much a giveaway that there's a fistula between the bladder and the vagina. Once the fistula is determined, the next step would be to map it, and that's usually a cystoscopy done under anesthesia, where we try to determine if the fistula involves vital structures close by, the kidney tubes or the ureters that come into the bladder, that bring urine into the bladder, to see if they're involved or not. If the fistula is close or involves the ureter, the repair is much more complex. If it does not involve the ureters and it's concentrated between the bladder and the vagina, or localized to the bladder and vagina, tends to be a little more straightforward. Complex still, but a little more straightforward. There's also imaging that can be done, certain kinds of fluoroscopic imaging that can be done to determine the extent of the fistula itself. So that's the diagnosis in a nutshell of vesicovaginal fistula. Rectovaginal fistula would usually involve a colonoscopy, usually done by a colorectal surgeon, and sometimes special rectal contrast imaging can be done to see if the fistula is present there. So that's a radiologic test that's done to determine if the contrast you put in the rectum leaks into the vagina. In a nutshell, that's the diagnosis of fistula, straightforward. I'm Lennox Hoyt, MD, fellowship-trained urogynecologist. Thank you for watching.